Well, thank you for that forecast, Devin. Seroma, though, is a common complication to surgery, and here to teach us more about seroma is Nurse Christina Paris. Thanks for joining us this morning.
Glad to be here.
You know, it is certainly an easier drive-in this morning than it was last Tuesday.
Yeah, absolutely.
Goodness gracious, it's like minus 30 out, it felt like.
It's cold.
But this morning we're talking about seroma, and it's a complication after surgery. So what exactly is it?
Correct. So first off, we can thank my mom for this topic because she is undergoing treatment for breast cancer and had this complication occur. So a seroma comes from the root word serum, which is the liquid or watery part of blood products. And another funny quick story is that when I was in nursing school and we were learning about serum, it said serum had a straw-like color, and I was so confused because I'm a city girl, and I thought the same thing. I was like, well, straws can be striped or purple or pink.
What color do they mean?
Hay. Straw, hay. So for all of you out there in Wisconsin who are like, oh, well, that was obvious. It was not to me. But
it wasn't to me just now.
It did come full circle. Anyway, okay, good. I'm glad I'm not alone. Anyway, so serum does have a straw-like color. And it can occur, these seromas can occur in any organ, tissue, anything, because when your body is repairing from surgery or any kind of injury, the first thing that occurs is you get fluid, or your body, gets blood and fluid to that area. So that's how these can occur. Okay,
that makes a lot more sense now. So is there a way to identify this post-op complication? Are we looking for the straw? Is that what we're looking for here?
Okay, so you can have liquid that starts to come out, and it will have that kind of clear, maybe a little tinge of blood in it, but usually you're gonna have a lot of swelling. You might have some pain or discomfort, and then, like you said, the drainage of that fluid. Now, some people that area or that tissue can get infected, and so you might develop a fever. You might find that the skin around that area is red. It might get really hard, and you can have some purulent or pus drainage, and those can be more serious. And in any case, a seroma can be very uncomfortable because you've got this tissue and now it's just being full of fluid.
Gotcha. So can it be treated or prevented in case, someone does come across this?
Absolutely. So the first thing you want to do is you definitely want to see your doctor if this occurs. And what they can do is they do these needle aspirations. So they can go into the tissue with a needle and pull that fluid out. Or sometimes they'll put in a drain and then it uses suction to draw that fluid out while you're healing. There's also a couple of there's sclerotherapy, which involves putting some kind of substance that irritates the tissue, which can cause it to seal off, or a lymphatic litigation. So your lymph nodes, and then we have lymph tissue, and so what they go and they do is they just kind of tie that off so that that lymph fluid isn't going in there.
Well, fantastic. So it sounds like, there are things to do, and nothing to worry too much about in case this happens, so long as you go to your doctor and get it addressed.
Absolutely, especially before infection can occur. And sometimes they'll just put drains in, and that's a great preventative. You also want to minimize some activity too, especially if you are undergoing breast cancer treatment. Brushing your teeth, combing your hair is fine, but doing really vigorous activities or where you're using your arms and stuff a lot is what can cause it. So you want any kind of surgery, follow directions.
Take it easy, follow the directions.
Slow down. I know for some people, like my mom, that's hard to do, but I keep telling her you've got to slow down.
Well, thanks so much for coming on in and talking about this with us this morning.
My pleasure.
All right.